Hey everybody, welcome back to Do It Right with Dr. Ansu. That's me. I know it's been a long time since my last video and I have good reasons. Partially it's just that life got in the way. As I mentioned in my first video, I still practice medicine, so I had a lot of work. I've got 3 kids. My toddler doesn't want to take a nap anymore. Kids had spring break, and before you know it, life just got very busy and I just could not make time for making or posting videos. I will be honest though, not being able to produce a video has been extremely stressful, borderline anxiety for me. I had promised to make videos and have something every week, and then that became bi-weekly, and now it's been over a month since my last video, and it was extremely anxiety provoking for me because I felt like I was not able to deliver to something that I had promised. And because of that, I felt anxiety was probably a pretty good topic to discuss today, because truth is, people experience anxiety all the time. They may not necessarily talk about it because, unfortunately, despite the fact that it is a very common thing in our society and in most cultures, anxiety and mental health in general is still considered very much a taboo topic. So you may be wondering if I have osteopathic manipulation I can use to help address anxiety, and the answer is yes and no. Yes, there are manipulation techniques I use in my patients who are suffering from symptoms of anxiety, the physical symptoms, the neck pain, the upper back pain, other issues that they may be having, but I don't have an OMT treatment to get rid of anxiety. However, if you remember my first video, I had mentioned osteopathic medicine is all about the mind, body, and spirit. The osteopathic principle takes into account that your physical health is very much a product of your mental health as well as your emotional health. Together, this balances how you're feeling. So if your mental or emotional health is not quite where it needs to be, it will most certainly have an effect on your physical well-being. So let's say if you're working a 12 to 16 hour workday and you've got kids at home, you've got a family to take care of, you've got responsibilities, and then you're somehow supposed to do self-care, and if you are involved in other activities, it will be a lot, and it will get you to a point of being so stressed that it can start affecting your physical health. It can start giving you headaches, body pain, muscle aches. It can affect your appetite, it can affect your weight, and it can affect your sleep. And we quite often see people who are suffering with anxiety having issues with insomnia, and it all stems from the fact that they can't quite get their mental health under control. So I hope with this video I'm able to talk more about anxiety and how to address anxiety and what role I play in helping my patients with anxiety. So let's get started. So let's start with talking about what anxiety is. I want to very clearly distinguish between anxiety and anxiety disorder. Anxiety is a very natural response to the stressors in our life. Everyone experiences anxiety at some point in their life, and this is your body's way of preparing you for something that is unexpected, something that's in the future, or something that just appears a little scary. So, for example, if you've ever watched the movie Inside Out, the animated movie, there is a character, this purple character named Fear, and he is one of the emotions of the main character, Riley. And he is this jumpy, always worried kind of guy, but his job is to make sure that he is that way because it's his anxiety and his worry and fear of what is to happen that prepares him and protects his kid, which is Riley. Can you imagine a life where you did not have that anxiety about things that are about to happen? You would be living a very dangerous life. You would be walking in the middle of a moving traffic. You would be going and grabbing snakes. You would be trying to cut yourself because you just do not have any fear of what is to come. Anxiety is a completely acceptable reaction to the stressors in life, whether that is at work, at school, at home, in your environment. It is also our body's way of reacting for something that is about to happen. So for example, when I was a kid and I did something that got me in trouble, my parents usually would say, "Come here." And that was usually their way of saying, "Come here," so you get disciplined for what you just did. But of course, I knew what was to happen. So every time they said, come here, my anxiety of what is to happen when I get there would prevent me from even moving forward and get there. It is that anxiety of preparing yourself for what is to happen or of the unknown. This is the feeling you usually feel when you do anything for the first time, whether that is the first time behind the wheel of a car, the first time you're about to do a zip line, the first time you're going to go down skiing, anything, or even getting into a relationship, that fear, that flutter, that palpitations. These are all ways of your body's response to the stressor that is about to happen. Anxiety disorder, on the other hand, is a magnified version of what people with anxiety feel with the stressor, except even when the stressor is gone, that anxiety does not leave, So people who are suffering with anxiety disorder are feeling stressed and anxious all the time, to the point that it is affecting their functionality. They are not capable of doing things that most people would be able to in a non-stressful situation. So let me give you an example. This past year with the COVID pandemic, we have been doing things we usually don't, So if you are somebody who would go to the grocery store and make sure your hands were sanitized before you went in, you had gloves on when you were touching things, concerned about anyone who's not wearing a mask and made sure that you were away from them, you came home and you were wiping everything down multiple times, you wash your hands vigorously every single time you left the house or even while you're in the house. If you were a person who did these things this past year, you have a small glimpse into the life of someone who suffers with anxiety disorder all the time. The things they do just seem so unnatural to those who may not suffer with it, but it is very crucial for them because they have so much anxiety about these things. DSM-5, which is the Diagnostics and Statistics Manual for Mental Health Disorders, describes general anxiety disorder as a condition characterized by persistent, excessive, uncontrollable, and unrealistic worry about everyday things. People suffering with generalized anxiety disorder let the fear of their everyday things overwhelm them to the point of them not being able to function properly. There are other types of anxiety disorders. So there's generalized anxiety disorder, there is panic disorder, there is post-traumatic stress disorder, PTSD, there's acute stress disorder, there's social phobias, there's OCD, which is obsessive compulsive disorder, and several others. But in all of these, it stems with anxiety. They are constantly anxious about something that's making them work a certain way, which is not quite considered normal or for the general public, but it is very much an inhibition for the people suffering with it. I have patients who, at the very thought of having to leave home, start sweating because they're just so worried about what the outside world would be like. These things affect their daily functional life. This state of anxiety can last for hours, affecting their physical health, their appetite, their sleep, their overall well-being, and this condition can last for months to years. So I make sure when my patients are coming to talk about anxiety that I am confirming and distinguishing whether they are feeling anxiety from an acute stressor versus they are suffering with anxiety disorder that is affecting their functionality. And it's important to distinguish that because the approach is different. Yes, both of them need a lot of cognitive behavioral therapy or CBT, but for anxiety disorder, sometimes they need to be on medication to help bring them to a point where things get easier, versus with acute anxiety, you may not necessarily need a medication, even if people are coming in thinking they need the medications. So for our discussion today, I'm going to talk about acute anxiety. So you may be wondering, as a family practitioner, how much anxiety do I really see? I hear all the time where people are like, aren't you just dealing with like strep throat or cold? Yes, I deal with that, and I deal with chronic medical problems, but I also deal with a lot of mental health. In fact, family practitioners, more than half their patients tend to be for mental health concerns. On a regular day, I may have 5 or 6 patients whose chief complaint is depression or anxiety. I may have a few others who are coming in for vague complaints like muscle pain, sleeplessness, and other complaints which as we talk about what's going on, stems from their anxiety. This doesn't even include those folks who already have an anxiety disorder and suddenly they have a new thing that is making their anxiety worse. And it's just not in adults. I have patients as young as 6 years old who are showing signs and symptoms of anxiety. This past year has been tremendous when it comes to anxiety. People were feeling anxiety in all forms. They were losing jobs, financial security was down. COVID pandemic had everyone all over the place with what is safe, what is not safe, who should they see, should they wear a mask, should they not wear a mask. Now with vaccinations, should we get vaccinated, should we not get vaccinated? People who were working from home and had children studying from home and trying to balance work and children's virtual school, teachers who were trying to teach and at the same time make sure their kids were doing good. There were so many cases this past year. I felt like practically every other person I was seeing had an anxiety issue that they were dealing with, and this is we see constantly in our office. Anxiety and depression is especially really high in the teen population, where teenagers are already going through lots of hormonal changes. They are getting adult-minded but not quite understanding the consequences of their thought, and now they are stuck in this COVID pandemic stay-at-home mentality, and they don't have a social life, they don't have an outlet. A lot of them are just relying a lot on social media, and sometimes social media doesn't help, and there's just been a vast increase in anxiety and mental health concerns in general in the teen population. So you can imagine, even as a family practitioner, I am seeing a lot of anxiety on a daily basis. And there are two ways I can address someone who is having anxiety. I can listen to them and hear them out and say, yes, you're going through a lot, you could benefit from seeing a therapist, and give them a referral for a therapist or a psychiatrist, which I do, by the way. But you can also go another route where you are listening to them and you are actually working with them to address their mental health, help them see the issues that may be causing it, so they have something to work on before they even see their therapist or their psychiatrist. And that's the route I choose. And partially it's because I'm an osteopathic physician, back to the osteopathic principle. I have to take into consideration my patient's mind, their body, and their spirit. I can't just address their physical health concerns and ignore their mental health. It would be like someone who's coming in for blood pressure problems, and I listen to them and I say, yes, your blood pressure is really high. Let me refer you to a cardiologist, without discussing lifestyle modifications, DASH diet, or potentially putting them on a blood pressure medication. Now, I'll be honest, it's not easy to do that. It takes time to listen to somebody and bring out information that they may not necessarily want to talk about or want to think about. Therapists get 45 minutes to an hour to do that. We, family practitioners, get about 15 to 20 minutes to deal with the same issue. It's not something that can be addressed in a 15-minute visit. So we usually tend to go over our time, which affects our next patients. And the next patient's complaining and they may have an anxiety issue, and that goes longer, and it does have a snowball effect where the family practitioner can be extremely exhausted because we are trying to do so much in such a limited time. And there's lots of family practitioners who may not necessarily feel they need to do that, and I don't fault them at all, because as I said, it takes time. It takes time to find out what's going on with your patient and to work with them, and it's not giving them poor care by referring them to a specialist, by referring them to a therapist or a psychiatrist, but it's just for my sake not enough. I don't want my patients to wait until they're seen by somebody to get care. If I believe my patient's mental health and their emotional health is affecting their physical health, I will make sure I can do whatever I can to help their mental and emotional health, so physically they're doing better also. So there are a few reasons why I approach my patients that way, and first and most importantly, it's because of my faith. I am a Christian, and one of the commands I follow is love your neighbor as yourself. And in the parable, Jesus, where he gives this command, the neighbor was a stranger to the person he was talking about, and when my patients come to me, they trust me. They trust me with their care. They trust me with things that they may not tell other people about. So I'm more than a stranger to them. So when they are hurting emotionally or mentally, I feel it is my responsibility, my Christian responsibility, as well as my physician's responsibility, to love my patient and to care for them and to care for their emotional state, because I know how it's impacting the rest of them. But the only reason I'm able to do that and provide them the care and the positivity is because I myself require that. It's not easy to be a physician in today's world, especially not in the Western world. I am a mother of 3 children, 3 little kids. I am a wife. I am a daughter. I am a friend. There are a lot of things that I have to deal with my own life, and then I hear my patients and all their suffering. So when I come home, I am just burdened, not just with what I'm going through, but also with what my patients are going through. And there is a verse in the Bible that says, "Cast all your anxiety on him because he cares for you." And I find such comfort in that verse because, it reminds me of when I was a kid in India. Coming back from school, I would see my mom standing at the gate of our house, waiting for me. And I would get so excited to see her that I would just leave my friends and run over to her and just take off my backpack and unload myself and give it to her and just start telling her about my day. And, it's such a distinct memory for me. When I come at the end of the day to pray, I literally feel like I am taking off this backpack of burden I'm feeling and casting it to God, and just praying and putting all my burden on him and praying about my patients. And it really helps me get over a lot of that anxiety that I feel, and in return I feel a lot of peace. And it's that peace and the strength that I get from spending time with God that I'm able to take to my patients and pass it on to them. Secondly, I went into medicine to want to help people, and not just physically, but also emotionally and mentally, So I feel like if a patient was coming to me, talking to me about their anxiety, I personally feel like I would be doing them a disservice if I didn't work with them and have a game plan, just like I would do with any other medical problem they would be having. So when my patients talk to me about their anxiety, we're talking about things that may be causing their anxiety. We're making goals. We're setting dates for follow-up. My patients are getting referrals for therapists and psychiatrists. So we have a game plan going on for their anxiety. And with that said, I hope that you enjoyed this video. I hope that you gained something from this video that was of some help. If you feel like you are suffering anxiety and maybe this video encouraged you to bring that to your primary care provider, please do so. Please do not suffer alone. And if you want to learn more, please send me a comment at the bottom. I will try to address it as soon as I can. If you like this video, please give it a thumbs up. Until then, please take care and come back to learn more about how to do it right with Dr. Ansu. Bye.